Oats are a nutritious whole grain that offers a variety of health benefits. They are a good source of fiber, vitamins, minerals, and antioxidants. However, there are a few cases where oats may not be ideal for some people. In this video, we will discuss some of the health problems where you might want to avoid or limit oat consumption. But before starting the video, be sure to smash the like button and subscribe to never miss out on any of our videos. Number 10. Kidney disease. People with severe kidney disease may need to limit their intake of potassium. Oats are a source of potassium, which is an important mineral that helps regulate blood pressure and muscle function. However, people with impaired kidney function may not be able to properly remove excess potassium from their blood. This can lead to a condition called hyperkalemia, which can cause muscle weakness, heart arrhythmias, and even death. If you have kidney disease, it is important to talk to your doctor about how much oat consumption is safe for you. They may recommend limiting your intake of oats or other potassium-rich foods. You may also need to monitor your blood potassium levels regularly. Number 9. Diverticulitis. Diverticulitis is a digestive condition that causes inflammation in the lining of your colon. During a flare-up, high-fiber foods like oats can irritate the inflamed tissue and worsen symptoms, such as abdominal pain, cramping, and diarrhea. It is generally recommended to follow a low-fiber diet for a few days during a flare-up to allow the colon to rest and heal. This means avoiding fruits, vegetables, whole grains, and legumes, which are all good sources of fiber. Once the flare-up subsides, you can gradually reintroduce high-fiber foods back into your diet. However, it is important to listen to your body and avoid any foods that trigger your symptoms. You may also want to talk to your doctor about a low FODMAP diet, which can help identify and eliminate specific foods that may be contributing to your diverticulitis symptoms. Number 8. Nausea or vomiting. If you are experiencing nausea or vomiting, oats are not a good choice. They are high in fiber, which can irritate your stomach and make your symptoms worse. Additionally, oats can be bland and difficult to keep down. When you're feeling nauseated, your stomach is already sensitive and easily upset. Bland, easily digestible foods like crackers, toast, or rice are much gentler on your digestive system. These foods are less likely to irritate your stomach and may even help settle your nausea. Once you're feeling better and your nausea has subsided, you can gradually reintroduce more solid foods back into your diet. Start with bland, easy-to-digest options like applesauce, bananas, or cooked vegetables. As you tolerate these foods well, you can slowly add in oatmeal. Number 7. Weight loss. While oats can be part of a healthy weight loss diet, they are still a source of calories. If you are trying to lose weight, be mindful of your portion sizes and total daily calorie intake. A standard serving of oats is about 1/2 cup dry oats, which provides around 150 calories. However, it's easy to pack on extra calories with toppings like nuts, seeds, dry fruit, brown sugar, or maple syrup. To control your calorie intake, limit added sugars and unhealthy fats. Opt for toppings like berries, chopped apple, or a sprinkle of cinnamon for sweetness. You can also add a scoop of protein powder to your oats to boost your feeling of fullness and help you stay satisfied throughout the morning. Number 6. After surgery. Following surgery, especially abdominal surgery, your digestive system is in a weakened state. This means it may have difficulty digesting complex foods like oats, which are high in fiber. Fiber adds bulk to your stool and can stimulate the muscles in your intestines to contract and move food through your digestive system. While this is generally beneficial for digestion, it can be uncomfortable and even painful after surgery when your digestive system is healing. Digestive discomfort after surgery is a common side effect, and symptoms like bloating, gas, and constipation can be quite unpleasant. To help your digestive system recover, doctors typically recommend a low-fiber diet for the first few days following surgery. This allows your digestive system to rest and heal without having to work hard to break down complex foods. Number 5. Iron deficiency anemia. Oats contain phytate, a type of antinutrient that can bind to minerals like iron in the digestive tract and hinder their absorption into the bloodstream. This can be a concern for people with iron deficiency anemia, a condition characterized by a lack of red blood cells due to insufficient iron. Iron is a critical component of hemoglobin, a protein in red blood cells that carries oxygen throughout the body. When iron levels are low, the body can't produce enough healthy red blood cells, leading to symptoms like fatigue, weakness, pale skin, shortness of breath, and dizziness. If you have iron deficiency anemia, it's important to work with your doctor to develop a treatment plan that may include iron supplements and dietary changes. Number 4. Medications for lowering blood sugar. Oats are a good source of soluble fiber, which can help regulate blood sugar levels by slowing down the absorption of sugar into the bloodstream. This can be beneficial for people with type 2 diabetes or prediabetes. However, if you are taking medications to lower blood sugar such as insulin or metformin, eating oats can cause your blood sugar levels to drop too low. This can lead to symptoms like hypoglycemia, which can cause dizziness, sweating, shakiness, and confusion. If you have diabetes and are considering adding oats to your diet, it is important to talk to your doctor first. They can help you determine how much oat consumption is safe for you and may recommend adjusting your medication dosage if needed. Number 3. Fructin intolerance. Fructins are a type of carbohydrate found in many fruits, vegetables, and grains, including oats. They are short-chain carbohydrates that are not easily absorbed by the small intestine. When people with fructin intolerance consume fructins, they pass undigested into the large intestine, where they are fermented by bacteria. This fermentation process can produce gas, bloating, abdominal pain, diarrhea, and constipation. The severity of symptoms can vary depending on the amount of fructins consumed and the individual's tolerance level. If you suspect you may have fructin intolerance, it is important to see a doctor for diagnosis and guidance on managing your symptoms. A low fructin diet can be helpful in reducing symptoms and improving gut health. Number 2. Skin conditions like eczema. While oatmeal baths are a well-known remedy for relieving itching and irritation caused by eczema, oats can actually trigger flares in some people with eczema or other skin conditions. The exact reason for this is unknown, but it may be related to a protein in oats called avenin. Avenin is similar to gluten, a protein found in wheat, barley, and rye. Some people with eczema may have an immune response to avenin, which can lead to inflammation and a worsening of eczema symptoms. Additionally, some people with eczema may be sensitive to other substances in oats such as phytic acid or saponins. These substances can irritate the skin and cause itching and burning. If you notice that your eczema worsens after eating oats, it is best to avoid them. Number 1. Celiac disease or gluten sensitivity. Oats are naturally gluten-free. This is because they come from a different part of the plant than wheat, barley, and rye, which contain gluten. However, oats can sometimes be processed in facilities that also handle these gluten-containing grains. This can lead to cross-contamination with gluten, which can be a problem for people with celiac disease or gluten sensitivity. Celiac disease is an autoimmune disorder that damages the small intestine when gluten is consumed. Symptoms of celiac disease can vary from person to person, but may include bloating, diarrhea, fatigue, weight loss, and abdominal pain. People with gluten sensitivity do not have celiac disease, but they may still experience negative symptoms after consuming gluten. These symptoms can be similar to those of celiac disease, but may be less severe. Thank you guys for watching. If you want more videos like this, make sure to like the video and hit the subscribe button, and we'll see you in the next video.